Now, I would like to request Honorable Mr. Fawad Hasan Fawad to deliver the keynote address on the subject integrating social health into public policy. Sir, over to you.
Thank you very much, Khwaja, and Bismillah ar-Rahman ar-Rahim. Let me start by thanking you for, bringing up a topic which is so central to policy making for the future of Pakistan, but which is also so much away from the eyes and ears of all the public policy planners in the health sector or even overall the national planning sector. And let me also thank each one of the panelists today for some very enlightened remarks and some, at least I am much more educated than I was at 6 p.m. when we started this session. So thank you to each one of them separately. I think all the issues that have been said here, each one of that indicates in one way or the other to two core issues. And one is the collapse of the governance structure in Pakistan, and resultantly, on the other side of it, as we fail to stop that, the fast decay in the familiar and the societal culture in Pakistan. These are the two things which, one way or the other come back to us if we hear all the speakers who have, enlightened us on this issue. Now, if we see that what has happened in Pakistan in the last 75 years, and when is it that this rot has started on the public health side? Pakistan on the health sector was not a badly managed country for at least the first 3 decades of its existence. And we were fairly well organized. And also, if I recall the times of my early childhood and the times of my adolescence also, I think as a society, as a neighborhood, as a city, as a school, as an area, as a family that we moved in, I think it was much more receptive and it was much more accommodative than what we see today. To me, and I'm just trying to, strike out or identify that where is it that this collapse started to occur. And when I'm saying that, I'm not focusing on the governance side now, I'm focusing on the side of the societal collapse. My humble view is that this started post-1977. And the change that came with the 1977 change at the governance and the political level introduced trends, attitudes, elements, narratives into our society, which started to make it more divisive, which started to make it more aggressive, which started to reduce the space for anything that we did not like or any differing opinion or behavior. And also, the social culture and narrative that the state patronized from that time onwards resulted in a lot of inhibitions. And those inhibitions in due course then resulted in due course, that was not really immediately, in a few years' time, in a decade's time, that resulted in all that we see. Like you start from how we look at our parents and how our parents used to look at us. Like I can very, honestly concede before this forum, before this panel, that I have much less patience with my children than my parents had with me. And it's honestly, whenever I think about it, I come to this conclusion. And I'll come to that later, that why it has happened, right? If you talk about the school, all of us went to different kinds of schools, but I, for one, went to a government school at the start of my life. I think the way the relationships between the children and their teachers, it can't be simply compared with the relationships today. And what we see or hear today in the schools, or the attitudes of different children in the school towards each other, and then the way their parents come in to support any kind of behavior that they indulge in, it's quite unbelievable if you compare it to that time. But this is a decline which is gradual and which is very, very clear. Now, Dr. Aisha probably at the start discussed the issue of drugs. Now, in my view, this too has two aspects. One is, of course, related to the collapse of governance structure, that the availability in outside the, educational institutions, even schools, high schools, universities, of course. But on the other side, the overall, what is it that the children, what happens to them at their homes and at their schools and at the educational institutions that they go to, that they are inclined more, what kinds of pressures we are creating in our society for them that they are inclined to go towards the drugs. What kind of, distance has emerged between the parents and their children that they are not able to communicate their issues to their parents and get it resolved. I think our society is now driven by all kinds of inhibitions. And those inhibitions actually now start at your immediate family level. The brother is not prepared to give space to his sister to grow up according to the way she wants. The mother is not able to treat both the son and the daughter equally. I'm talking about the majority. There may be, a family or two or a small percentage where this does not happen. But I'm saying that where it is all coming from, where is it? So there is a problem that starts right at the home, right? And then the issue that how much time is now available with the parents to look after their children in terms of their immediate needs. I'm not talking about the financial needs. I'm talking about the need of the time that they need to spend with them, or, inculcating in them some basic value systems that has been a part and parcel of our society and which is no more there. So starting from that, it is, if we try to understand that, and if we see that the larger familial structure has also collapsed, in which the grandparents or, because, we are now not the joint family system that we used to be, where if, the father or the mother was busy with their work or with their social life, somebody else in the larger family was able to look after the children. Here they have either the maids or the servants to go to, or virtually nobody to go to. And that is what drives them to a mental state where they feel left out, where they feel isolated, and in turn then susceptible to all kinds of exploitation. And that is not only the drug abuse, then that can result in many, many kinds of abuses. Similarly, if you see, some of the oldest institutions, educational institutions, the value system that those educational institutions used to represent, and I'm talking about across the divide now, the government schools and also the so-called the HSNs of Pakistan, the value system that you used to represent, it is no more there. It is definitely not there anymore. So, each one of these institutions is now facing the same kind of bullying. It is facing the same kind of different groups or different, groups of slightly better off families, children of slightly better off families, treating the children of slightly less better off families with contempt, or detest them, or, grouping children grouping as friends, not on the basis of things that they identify with, or games that they play, or the hobbies that they have, but rather than the economic circle that they come from, which means that there are virtually no basis for them being friends. And that is why these friendships are not carrying on anymore. Like from our times, our friendships from school time are lasting till today, because those were not based on economic well-being of one or the other. Today, everything has taken a new shape. The society is being identified with money, and money alone in preference to any other thing. And, again, my view is that this massive shift, this massive change started to come in 1977, because a whole new culture was brought in. And if you look at it historically and trace it back, I think most of you will be able to find from your own experiences and from your own memory bank a number of things which will support this. Now, Dr. Mawadat also very rightly pointed out to the issue of the health sector getting hijacked by the procurement processes. I think it was such an important point to hijack, that the public sector health policy is not driven by the realities on ground. It is not even driven, or it is not even shaped, or not even, let me say, studied with reference to the issues that the modern society has, or today's society has, or what is it that we need to cater under the health service delivery system. It is not taking into, it is only driven by one thing, and that is what Dr. Mawadat said. I'm just reinforcing that. It is just driven by the health sector's total giving in to the procurement of what you say, the pharmaceuticals or the machinery and equipment. And, I've been, having worked as a health secretary myself, I think that the biggest challenge that any administrator in the health sector had was how to stop that rot. I used to call it a rot. The rot that a small hospital in the center of, Punjab, it had 2 CT scans of 16 slices, but it now wanted to have 2 CT scans of 64 slices, because there was somebody who was pushing this procurement. And, all of a sudden, you would see that all the hospitals across the province, their boards would come up with the same requirement. And when you would ask them that what is this requirement based on, because this is a very specialized equipment which will be probably needed, maybe 1 CT scan of 64 slices is needed by Punjab Institute of Cardiology. But why are you, being a general hospital, asking for, the similar machinery where you do not have a facility of neurosurgery or cardiology? But, just to, support the point that Dr. Mawadat said, that the health, it is not a health policy framework. It is a health system procurement framework which drives, and this is across the whole country. And, there is something that has to be done about that in due thing. And of course, as early as of yesterday. Now, I think one more thing, and that was referred to by, more than one speakers, is the fast emerging divide between the haves and have-nots. And of course, all of us are a witness to that. We are seeing it increasingly happen. And the pace of this divide is getting faster and faster and higher, bigger and bigger. The delta between the various segments of the society that we saw in 20 years back is now, not even relevant anymore. The delta is too big now. And why it is happening? It is happening again because of the collapse of the governance system. Collapse of the governance system because the state has, been able to, at small little phases in our history, able to generate wealth, but has totally failed at equitable distribution of that wealth, which was to be done through the taxation system.